Arthroscopic anchor fixation with absorbable sutures for Pipkin type 1 femoral head fracture, letter V technique. Our authors have no potential interest to disclosure. Here we introduce our technique through the case of a 14-year-old patient with femoral head fracture. The fracture was caused by a car accident. Preoperative evaluation was performed and the radiology showed it was a Pipkin type 1 fracture. The patient is placed on a hip arthroscopy distraction unit. The AL, DALA, and MA portals are established as observing and working portals. Arthroscopic exploration of the hip joint was performed to reveal the concomitant injury. All free osteochondral fragments were completely removed and the tall ligamentum teams were debrided with a curved shiver. Releasing the traction keeps the hip flexion. The femoral head fracture is evaluated. The displaced fracture fragments were well reduced with a probe. Temporary fixation was performed with a 2 mm key wire. 3 anchors was placed, 2 anchors in the medial row, 1 anchor in the lateral row. The sutures were tied in a double pulley fashion. The sutures on the surface of the femoral head eventually form the shape of letter V. The stability of the fracture suture fixation is conformed with the hip flexion and rotation. Finally, the joint capsule is closed with non-absorbable sutures. Post-operative rehabilitation. A hip brace is recommended immediately after surgery. Hip flexion is restricted to 30 degrees to 60 degrees for 2 weeks, 90 degrees for 4 weeks, and 120 degrees for 6 weeks. Partial weight bearing with crutches was restricted for 6 weeks. Half squatting can be resumed 3 months after surgery. Competitive sports activities were prohibited for 6 months after surgery. The fragment is reduced after fixation comparing to preoperative radiograph. The anchored position was satisfied shown in the MRI. Here are the perils and pitfalls of our technique. These are the advantages and disadvantages of our technique. Thank you.